So let's talk about what is a compound stimulus. Most SDs are comprised of compound elements or features. And let me give you some examples. A lot of the examples I'm going to use are based on language kind of stuff, especially receptive language, because in my uh, uh, dealings with the program I was with in terms of the University Pacific Severely Handicapped Credential Program, we focused a lot on children with severe, profound, again, what we used to call mental retardation, which is now ID. So here's some examples of instructional commands or requests. Touch the ball. And you might think, well, so if somebody asked you, what's the SD? You would say the SD is touch the ball. And the molar stimulus is yes, that's it. But notice that it has three separate words. And within each word, not within each word, but for example, touch has two phonemes or sounds, two different sounds. So there's many elements. And we assume that when the child learns to respond by touching the ball, when you say touch the ball, that all the elements are controlling the behavior. That may not be true. Another example, when is your birthday? And even single word in print, for example, the word nonsense, okay, has five, excuse me, I wrote five letters. It's actually eight letters. Five of them are what I call critical. So compound stimuli are usually what you're doing when you are presenting instruction to children who you're serving in terms of discrimination learning. Okay, so to decipher why a child is not acquiring a given discrimination, you have to study and analyze the elements within a compound stimulus. And yes, we will get to in this webinar how to do that. Okay. So a molecular analysis of the compound stimulus is essential. And somebody might say, well, how do you know it's not motivation? Okay, there's actually tests that I designed for determining whether the lack of a behavior is due to motivation or not. It's in my functional behavioral assessment text, and there's also a open source article I wrote on analog assessment. If you're interested, again, email me and I'll give you the reference. It's in the ERIC database. Okay. All right. So here's a two sample conditional discrimination task. In other words, it's conditional in the sense that what behavior you're going to perform is a function of which of these two things are precedent. So touch the ball and touch the spoon, right? You can substitute other nouns that you may use, but anyway, I use these. Okay, now here's the feature. Here's what you need to understand in terms of molecular analysis. There are basically two features or elements. Okay, Barb Etzel in 1982 at the University of Kansas and her colleagues, Judy LeBlanc and I'm forgetting some of the other ones, published a study, and Laura Schreibman again in 1975, and myself in 2012, the open source article. Two basic elements, critical and non-critical. Well, critical features are basically the things that you have to attend to in order to get the answer right. So in this particular case, you see the two commands, touch the ball, touch the spoon. Okay. If you are going to attend to one of the elements within those sentences, if you attend to ball and spoon, given this discrimination task, not others, but this, okay, you have to attend to ball and the sounds of that and spoon. So those are called critical features. They're critical to discriminated behavior, correct discriminated behavior, given, again, this two-choice discrimination task. Now, what are non-critical features? Well, I call them identical. Etzel called them redundant, but basically they're the same. Okay, and you can see in blue, I've wrote touch the, and then ball again is critical feature. Touch the is a identical feature. It's identical to both commands, right? And also, what I've learned is that your vocal output is common to both. And what I often said with my students who are in special ed, waiting to become, hoping to become special ed, severely handicapped credentialed teachers, is that many of the kids you work with don't understand the English language. They're not sensitive to the individual phonemes. They hear you open your mouth, something comes out, okay, and it all sounds the same to them. So so if you had a tenant which says, well, they just need more practice, okay? If they're not attending to the correct or the critical feature, you could what happens is the same thing that happened to Lovas, which you should go through hundreds and hundreds of discrete trials, and you don't get anywhere. See, even with reading words, I'm not going to dwell on this, but some kids with LD, you may see that in some circumstances, errors are made because they see, here's two words, nonsense and nondescript. All right. Both of them start with non. And I think there was a study done by somebody I'm trying to, Walpole, the University of Massachusetts people, did a study where they found that the more similar words were to each other, the greater the overselectivity or the greater the error pattern. In other words, when words are very dissimilar, you get greater responses, correct responses. In fact, I knew this back in the 80s because I used to, for the few kids we had where we were doing home programs through my private practice, and we were teaching some reading capability to get the kids, what I call give them an edge when they went to school. The Edmark reading program was something we used. And the words that they start with, in fact, they start with match the sample, but the words they start with were very discrepant. It would be something like, I'm trying to remember, airplane and the, okay? So you could make that discrimination, just that discrimination, which they will target initially on the basis of many different features. You could see that one starts with A and the other one starts with T. One is shorter, one is longer, one is, and even the form of the way the would present is different than airplane. So they start with very gross differences in terms of discrimination learning. And then as the learning proceeds in terms of mastery, the discriminations become finer. But if they had started with airplane and air flocked or something like that, it would have been a much tougher discrimination. Even maybe, this would be interesting to test. Even if the match the sample skills were, good, maybe not, but they capitalized on the fact that we're going to get correct. And the Edmark reading program is so flawless, developed by Sidney Bijou, but it's just a great program to begin kids that are non-readers to start learning how to read actual words and be able to see these things and go, oh, I know what that word is. Anyway. All right, so let's look at some other critical features. Here's the discrimination task. When is your birthday? When is her birthday? Okay. What is the critical features? Notice that when is identical to both, and so is birthday. So in order to get this discrimination correct, what do you have to respond to? Yours and hers. Some of you who have tried to teach this may have had difficulty with this in the beginning until the kid kind of gets it. All right. But this is not something you would start with as a first discrimination. You start with very simple kinds of discriminations. This is a more complex discrimination. Here's another one, a two-choice discrimination. What day is your birthday? What month is your birthday? They have to attend to day versus month. Okay, so the critical feature, the way you diagnose that or identify it is with respect to the specific discrimination task you're working on. It's not something like this word will always be the critical feature. No, it depends on what the elements of the discriminative stimulus are, the presenting stimulus. Simple discriminations have basically one critical feature, but many of the tasks you hopefully get to when the child progresses has two critical features. For example, here's the discrimination task that varies both the action, touch versus pickup, and the item, ball versus paper, or any other bag, etc. So you could have a discrimination task that requires the child to engage in two or more distinct actions on two or more, or actually it'd be four. You'd have to have four because it's a 2 by 2. So you would have touch the ball, pick up the paper, touch the paper, pick up the ball, and then maybe others. So understanding what a critical feature is very important for diagnosing and then solving. All right, let's get to the diagnostic model. The three categories I write about in my paper 2012, it's open source. It's actually on handout A, or the first handout. You'll see a link to it, so you can just click there and then it'll come up and you can download it. I didn't want to put it as a handout because I'm not sure what the copyright issue is, even though it's open source. I don't know if I'm capable of, if I'm violating copyright if I post it somewhere. So I just give you the link and you can download it because it is open source. So identical features is one category. Irrelevant features, which I'm going to just ask you to read in the paper to get an idea what that is. And then the third category, incomplete stimulus control features. This is where you have multiple critical features, like I just talked about in terms of two actions and two or more items. So sometimes you have three or more. So multiple critical features. Okay, so here's my the copy of the first page of my paper, Stimulus Overselectivity, Empirical Basis and Diagnostic Methods, I think it says. But anyway, download it. And if you would, do me a favor, for those of you that are in BCBA programs or already graduated from one, send an email to your mentors, faculty who are interested in learning, maybe teach the basic course and concepts in learning or whatever, and send them this material, handout A, and also handout B, we'll get to later. Poll question number 3.
There it is. We're gonna give you a few seconds to get your answers in. We still have a couple of people still responding. All right, I'm gonna go ahead and close the poll. There are the results.
Okay, well, I'm excited to see that because I know it's very difficult to do reading when you are employed and so forth, but I'm elated that 82% of you will absolutely do that. Thank you very much. I appreciate it. And again, if you're going to be in this field, you have to know that reinforcement alone, in some cases, is not going to solve is not going to win the day. You have to understand why the kid is making errors. You know, this model that that I presented is really the analog to the functional analysis for behavior. In other words, when you try to solve a behavior problem, what do? Well, you try to understand why it occurs. Well, this is the same thing, except it has to do with learning tasks. Why is the errors occurring? Okay, well, here's the jewel that hopefully you've been waiting for. Section 4, the voice volume contrast. This is a technique that, let me go through this. What happens when identical features control the response? So if the child hears the word touch, in fact, I saw this when I worked with kids with ADHD. Now, they understand language, they just have impulsivity. So I would say, okay, get ready. And they're already picking, you know, wait a minute, I haven't even told you what to pick yet. Okay. So I actually developed a technique for them as well, which is fairly similar to what I'm going to go over now, without the volume contrast thing. But anyway, so if they're responding to the word touch, or as soon as you open your mouth and start talking, okay, that's what controls their behavior. You can see that touch the bowl versus touch the spoon as the discrimination task. You're not going to go anywhere. Oh, let's do an experiment. Um, and this is voluntary. So what I'm going to do is I'm going to ask you to either touch your nose or touch your ear. Okay. And I'm going to try to run 3 or 4 trials here. And then you tell me how well you did. Okay. You ready? Touch your, okay. Trial number 2. Touch your, ready? Touch your, ready? Touch your, okay. Here's the answers. 1 in 4, trials 1 and 4 were nose, and the other 2 were ears. Okay, now I know you all respond well to English, and I did this for a reason to demonstrate how these kids respond to something that is not critical. Okay. So because you couldn't hear what I said, I'm sure a lot of you got 0 out of 4, or maybe 1 out of 4, or maybe 2 out of 4. Maybe some of you were lucky and guessed correctly, but it truthfully was a guess. And if I had run 15 or 20 trials or whatever, we would have generated a fairly high error rate. So think about this experiment when you put this into practice in terms of the things you're going to learn. So responding to the word touch or any non-critical feature produces an initial and persistent lack of mastery. And one of the things my diagnostic system does is it actually explains why kids make errors right off the bat. Okay. Even some of the stimulus over selectivity research, what they show is, well, we had a discrimination when we paired these 2 things together, the compound stimulus, and then when we pulled them apart, we found that they weren't. Okay. What mine shows is that when you are responding to particularly identical or redundant features, you're going to get high error rates right off the bat. You're not going to get off the ground. And I think that's maybe the contribution that my paper and work and this webinar has to the field. Okay, let's see. What qualifies me to present on this topic? I'm just going to give you a little, maybe, I hope, storytelling is always interesting to some people, maybe not to others. But when I taught at the California School of Professional Psychology in the 90s and the early 2000s, I learned to talk about cases because the students who were clinical, I was in a child clinical doctoral program teaching, and they didn't like behavior analysis too much. But what they did like was the explanation of how to solve a case. Okay, so I kind of developed it there. But anyway, um, I'm not a researcher in stimulus over selectivity. I've actually never published an article delving into stimulus over selectivity. But what I am is a clinician who worked a lot with kids where that was a presenting characteristic or concern. The program that I developed my skills in 1981, I took a professorship or an assistant professorship at the University of the Pacific in the Department of Special Education. We had a very unique program. And one of the classes or actually 2 of the classes we had that were the beginning was not just the basic principles of behavior analysis, but also it required them to actually do clinical applied work with real life kids. And the way we did this was we would hold that particular class. So I remember it met in the fall and in the spring semester. It met once a week for 3 hours, and we go out to what was called the Development Center for the Handicapped, where they had kids with severe, profound MR, ASD, in other words, low incidence disabled kids. And we would get consent to actually work with these kids. So they would bring a kid in. And before I gave him so each of the graduate student, actually 2 per kid, was going to work with one of these kids with autism, etc. But before they did, I would sit down with the kid to gain instructional control. And this is where I honed my clinical skills, is that it required me to face somebody I just saw walk in the door and obtain instructional control and then start teaching. And of course, they would volunteer, oh, he's working on whatever. Okay. So one of the kids that is the genesis of my voice volume contrast technique in the 1980s. He came in, I guess he was about senior elementary, maybe early junior high age. Um, and a very affable, jovial kind of kid. He came in and they said, so and so is working on prepositions. So here's his material. So they gave me a box and then they gave me a cube. And what he was to do was I was to give him a command such as put the cube on the box. And of course, so, and they said, well, we're teaching him on, in front of, besides, under, Okay, so I run a baseline and he's got none of that. Okay, yeah. And they probably were teaching him that when he was 6 years old when he first entered, and he's now 11 and he still doesn't have it. Okay. But he's a very pleasant kid, so he's not creating severe behavior problems. He just, puts the thing in and smiles and so forth. And, they probably corrected him like, no, that's not in front of, that's beside. Okay. So here's what I did. And again, this is why you have to understand the critical and non-critical features, identical features. All right. So put the cube on the box, put the cube in front of the box. What are the critical features? On and in front of, the prepositions. What are all the identical features? Everything else. What do you need to do to make this this SD more prominent, more, what's a good word? More um, evident. You get rid of all the identical features. So what you would do is say, oh shoot, sorry. What you would do is say in front of and on. So I selected a two sample discrimination task, got rid of the identical features. Now I just have the critical features. Okay, but one has got three words and one has got one word. So I got to fix that. Okay, because I don't want that to be the basis for discriminated behavior. I want the front command controlling behavior and I want the on command. All right. So get rid of in front of became front and on became on. Now, in addition, what I did was I capitalized on this, and this is what I thought of when I was doing this. I said, many kids I've worked with before. I was in the field since 1973, working at Sunland Training Center in Orlando, and so I had worked with kids with severe disabilities for a long time. And I said, one of the things that I noticed, and it's not hard to notice, is that they will change their behavior when you yell at them, which is why the aides and the other people that handle these kids, when they want them to stop doing something, they go, hey, and so the kid stops, right? So voice volume controls behavior. And I thought, why don't I just use that as an additional prompt? So what I would do is I would say front very loudly, and I would point to where it was to go. And, within a couple of point prompts, he's got that. Okay, now I've got to go to the other one, the other stimulus, right? And what I did was, and so this is going to be on the box. Okay, so what you would have heard me say is front, front. So there's a clear voice change, a contrast, right? You will develop discriminated behavior quickly. And again, you can't, if you don't understand the difference between critical features and non-critical features, some people would add voice volume to the whole sentence. That creates no better issue than what you had before. Okay, because the identical features are still there. What you really want to do is get the critical features under volume control. And then what are you going to do? Okay, once that happens, and by the way, if you find yourself point prompting on receptive or other tasks, you need to change the way you're delivering it. that kid could be there until he's ready for Social Security. Okay, so that's why this topic is so darn important. And I'm so glad that Caravo and a few other people in the country are looking at this, because this is what Lovaas understood back in the 70s and why they were getting the results they did back in the 1987 classic outcome study of the UCLA Autism Project, Young Autism Project, excuse me. All right. So now we have the volume controlling behavior. What do we have to do? Well, we just have to fade the volume. So front becomes normal conversation, and on gets louder. Okay. So I'm not going to go through that, but I assume you can do that. Very quickly, you would get discriminated behavior to front and on being presented in the normal conversation tone. Then it's just a matter of bringing in all the identical features. I would suggest that before you do that, train a couple of other nouns so that you could get, front, on, beside, or whatever. Okay, so you want to build a base of 5 or 6 uh, stimuli within the task at the normal conversation tone with just the um, noun, and then you start fading in the other stuff, or the preposition in this case. Okay, so get the ball and get the gloves. Here's another example. You would say ball very loudly, gloves very softly. Notice that get the is removed. So again, you need to get rid of the identical features that are creating the problem. Take the critical features, make one loud, soft. When you get discriminated responding fairly quickly, then you then start fading the volume until they're the same volume, and then build a couple of other nouns, and then you can start fading in the sentence. Because when you want to go something like get the ball versus touch the ball or throw the ball, then they need to pay attention to the verb, right? The action verb. So it's important first to develop nouns and then develop the action verb. Okay. So fade in the identical features only after critical features alone are required at the normal conversation tone. Okay, where are we? I want you to use the on-demand. So again,